The total of confirmed COVID-19 cases in New Hampshire is nearing 1,100. An additional 4 deaths are being reported from long-term care facilities, including 3 at Hanover Hill in Manchester and 1 at the Huntington in Nashua. But doctors say there are some signs that the pandemic in New Hampshire is stabilizing. The epidemic curve appears to be hitting a plateau.
The last 7 or 8 days, there have been on average about 70 patients per day hospitalized throughout the state, and this has been a stable number. What does this mean? This means that the number of new patients being admitted with COVID-19 has equilibrated, or has been about equal with the number of new patients that are with COVID-19 that are being discharged.
Public health officials say that's a good sign that social distancing and the stay-at-home order are working, but those measures need to remain in place to continue being effective. Governor Chris Sununu says even though New Hampshire is not joining the East Coast Compact organized by New York State, he will be working with other regional governors on a plan to eventually relax community and commercial restrictions.
So we are still in this for the long haul. We are not coming out of this in the next couple of weeks. We hope maybe this summer and in the next couple of months. But that's just the reality. You know, one thing, my unfortunate job is to plan for the worst and hope for the best. That's the responsibility that we have. But we are going to start that planning now. We're going to start seeing how things could possibly open up.
Now, Governor Sununu says he didn't get a call from Governor Andrew Cuomo of New York about that East Coast Compact, but New York has said any state that wants to join can. Nonetheless, it appears there will be a level of regional coordination when it's safe to finally reopen the economy. Reporting live in Concord, Adam Sexton, WMUR News 9.
Adam, thank you so much for that live report. The state will also start providing extra financial benefits for some frontline health workers. WMUR's Tim Callery continues our team coverage with the details of that program. Tim.
Well, Mike, this program will provide a $300 weekly stipend to employees of Medicaid-funded long-term care facilities and other social service organizations. Now, the governor says he wants to make sure that the employees of these facilities has backing from the state. He says they are critical staff that support some of New Hampshire's most vulnerable people. Qualifying organizations can file an application through an online portal that is set to go live tomorrow. However, in order to participate in this program, the governor says those organizations must agree to pass 100% of all stipend payments to their frontline workers. Those are people who are entering these facilities on a daily basis to take care of patients. The Department of Employment Security will use general funds to pay for those stipends with the expectation that the money will be backfiled by federal funds down the road.
This program ensures that the critical staff that support some of New Hampshire's most vulnerable individuals, those with physical disabilities, developmental disabilities, and older adults, get uninterrupted care during the COVID-19 emergency.
And now the governor says, to his knowledge, New Hampshire is the only state offering a program like this. Live in Concord, I'm Tim Callery, WMUR News 9.